Welcome to Chapter 53, An Introduction to the Male Reproductive System. So the scrotum is the pendulous sac on the outside of the body that encloses each of the two testicles in separate compartments. The two testes are the male reproductive organs, and they have coiled seminiferous tubules that produce sperm. The epididymis is a passage about 20 feet long that allows sperm to mature and can travel along that passage. It gets to the vas deferens where it's stored, then onto the seminal vesicles that produce fluid for sperm mobility. The prostate gland produces liquid for motility and propels semen into the urethra. Cowper's glands are very similar to female Cowper's glands, and you can see there are some similarities between female anatomy and male anatomy. So the Cowper's glands secrete mucus. The urethra empties urine from the bladder and provides outflow for semen. The penis is a round cylinder. It also has a part called the glans, which is the end, the corona, and two corpora cavernosa, and also provides for erection. This is a cross-section of the male human body. I like for you to see how everything kind of fits together in the body. So you can notice the colon probably pops out at you first, the rectum, the bladder, the prostate gland. I want you to see how everything looks from the side view. The penis, the testes, the epididymis. These are all going to be important in some of our discussions. So spermatogenesis is where spermatocytes develop into sperm, and that is triggered by testosterone. Cryptorchidism is the failure of the testicles to descend from the abdomen. Now that can be harmful and can cause infertility because they need to be in a cool area, so they need to be outside of the body. Erection is a flaccid arterial blood pressure of about 6 to 8 millimeters mercury. But during erection, the penile blood pressure is the same as the arterial blood pressure. Emission is a result of the sympathetic stimulation that leaves the spinal cord. Well, this becomes important when we start talking about some disorders related to spinal cord injury in the male reproductive system. Ejaculation is expulsion of the sperm. So the phenomenon of the male climacteric, as they call it, and may be associated with symptoms of hot flashes, feelings of suffocations, psychic disorders similar to those of menopause. Another similarity we have. Testosterone decreases rapidly after age 50, but men in their late 40s and early 50s may be slower to arouse and have a longer refractory period in between erections, but in a healthy man, spermatogenesis and the ability to have erections lasts a lifetime. So it's important to do a health history or assessment when we first receive our patient. So what is the reason for seeking care and present health? So do they have pain? And if they do, where is that pain? What kind of pain is it? Sharp, stabbing, dull? And let's rate that pain on a scale. It should be 0 to 10, right? 0 is no pain at all. 10 being the worst pain. We want to know their past health history. Anything that's occurred or happened to them in their past, as well as diabetes, cardiovascular disease, family history. Is there anything that runs in the family? We want to do a good review of systems and always a functional assessment. How are they doing? How are they moving? How are they functioning in everyday life? Then when we get to our physical exam, we want to examine the male reproductive parts, the penis and the scrotum. I want to mention here, and I have a picture in just a second, and you also have a picture in your book, figure 53.7, of a hydrocele, and that can occur in the scrotum. It's a mass filled with serous fluid that glows red in the light. Now, I'll get to that, but I want to reinforce that because it's important to know. So this is just a picture of a circumcised penis and an uncircumcised penis. This the foreskin that comes up over the glands. It was for protection. Then they started doing the circumcision for cleanliness purposes. And if you are giving your patient a bed bath and they are uncircumcised, be sure you pull back the foreskin and clean all around there, because it can develop some thick secretions that can lead to infection. So it should be cleaned well. Here's our picture of the hydrocele, a mass, and it glows red in the light. So that's a really good picture. Some diagnostic tests and procedures. So a lab test would be semen analysis. Now that's important, especially in fertility or infertility. The evaluation of sperm for their count. How many sperm are in that particular specimen? How's the motility of the sperm, the shape of the sperm, and the ability to penetrate the cervical mucus. To obtain, the patient should abstain from sexual activity for 2 to 3 days and then collect the specimen. Now, it's important to know how a semen analysis is collected. Some endocrine studies should be done. Those are lab tests. They can be looked at, may tell us some endocrine problems or other disorders that might lead to the problem that they're here for today. A tumor marker for prostate cancer is important. The PSA is a screening tool for prostate cancer. Now, a normal PSA is 0 to 4. General lab studies and ELISA. Now, ELISA is a group of lab tests. One of them is the mumps virus. So mumps can be very harmful to the male reproductive system. So that's important to remember, the mumps virus. Having mumps may result in sterility. Urethral smears and stains are studies to detect STIs or sexual transmitted infections and identify any pathogens. There's also some imaging studies that can be done, CT scan, computed tomography, ultrasound, or radionuclide studies. Now on page 1056 are some of the things that I discussed now. The ELISA test, again, I'm just going to repeat, determines whether a person is susceptible or resistant to the mumps virus. And then the urethral smear is a study to detect STIs and identify pathogens. Again, that's table 53.2. Also, the tumor marker is important, the PSA, and the normal is 0 to 4. So anything higher than that could mean that the patient has prostate cancer. And then the cystoscopy is another one listed here. It's a lighted instrument inserted through the urethra to visualize the urethra, bladder, and prostate. It can detect bladder tumors. So what's some drug therapy? Well, that's on page 1058. So I'll start out with androgens. What are androgens? Well, those are testosterone, replacement for testosterone. If the patient is running low on testosterone, they might need an androgen. There's oral IM, transdermal patches, there's gels, and there's an underarm solution, implantable pellets very similar to birth control. There's also buccal, which is just in the cheek. So drugs that are used to treat BPH or benign prostate hypertrophy, those are listed. Also testosterone inhibitors. So Ulexin, it's important to remember, you might highlight that on page 1059. Ulexin, it may cause hot flashes in the patient because we're blocking testosterone now. So by doing that, we might get some female type of symptoms. Another drug is nalandron. Now, with nalandron, the thing is the patient can get hepatotoxic. So you want to be sure to get that liver function test. Those need to be monitored while they're taking this drug. Some more drugs would be the CYP, 17 inhibitors, immunotherapy, gonadotropin releasing hormone antagonist. So Lupron, if you'll notice, is a gonadotropin releasing hormone. That is or can cause hot flashes or flushing and is used for cancer of the prostate. Another drug is Viagra, and those are agents to treat erectile dysfunction. That's on the next page, table 53.3. And the instructions that we would give the patient for Viagra is to take it 1 hour before sexual activity. Now, because it increases blood flow to the penis, it also might increase blood flow elsewhere and raise the blood pressure. So any patient that has an MI or history of MI or any cardiovascular issues need to be warned about this problem. So need to be sure and ask if they have any cardiac issues. Other drugs would be MSIT, which is a hybrid of estrogen. So that is on page 1061 under other drugs for disorders of the male reproductive system. That one's important to know. Hybrid of estrogen, but a side effect, because it is estrogen, a female hormone, the side effect is gynecomastia, or they may develop some breasts. All right, this is a pretty short chapter. Let's try question number 1. The primary storage site for sperm is what? Storage site. So the correct answer is D, vas deferens. Mature sperm leave the epididymis. They enter the vas deferens, which are tubes of secretory ducts that serve as the primary storage site for sperm. And they contribute to the fluid content of semen and contract to help propel the mature sperm into the urethra. Question number 2. Sperm are produced in the what? Give you a second. So the correct answer is D, seminiferous tubules. Sperm are produced in the seminiferous tubules of the testes from about age 13 throughout the remainder of the life. All right, thank you. I'll see you in a minute for the next chapter.